Good afternoon, everybody. Thank you for braving this weather today. I'm here with our Commissioner of Health, Dr. Lance Frye, Deputy Commissioner of Health, Keith Reed, and Secretary of Education, Mr. Ryan Walters. 2 months ago today, on December 11th, the FDA approved and cleared the Pfizer COVID vaccine. We have come a long way in that last 2 months. I'm proud to say that as of today, 441,000 Oklahomans have received their first dose of the vaccine. 167,000 Oklahomans have received both doses. Our cases are down 59% from their peak last month, and hospitalizations are down 56% from their peak. You know, hospitalizations are something that we've tracked very, very closely. We've been on COVID calls and getting those updates every single day since last March. And to see that positive trend of hospitalizations going down, it's just, I know it's a breath of fresh air for our wonderful healthcare workers, our hospital administrations, the chief medical officers. So that's really good news for Oklahomans. We've vaccinated hundreds of thousands of Oklahomans who are most at risk. Residents and staff of long-term care facilities have been vaccinated, Oklahomans 65 and older, and healthcare professionals all across our state who are working so hard to keep Oklahomans safe. Oklahoma, I know this has been a tough last 10 months, but we are making great progress in our fight against this virus. Let's keep making wise choices to protect our families, our neighbors, and especially the most vulnerable. My promise is to follow the data and make the right decisions at the right time for Oklahomans. From the very beginning, I set out the priorities for our team. And number one was to protect the health and lives of Oklahomans. Number two is to keep our businesses open safely. And number three is to get our kids safely back in the classroom. I'm excited to announce today that we are moving further into our vaccine plan. For weeks, we've been vaccinating teachers and school employees over the age of 65. In the next few days, we'll be making the vaccine available to school teachers and staff of all ages. We're also opening up to all Oklahomans with comorbidities the ability to get the vaccine. Just a week after the vaccine first came out, I got with Dr. Frye and his team at the health department to move teachers up in our priority list. I know this has been a really tough year for parents, for students, for teachers, for staff all across our state. And that's why I'm proud to be able to get this vaccine out as quickly as possible. Each day that goes by, we learn more and more about how important it is to get our kids safely back in the classroom. I want to continue to thank the teachers, the bus drivers, cafeteria workers, the administrators, and all the other school employees who have been working so hard to put their students first. I also want to thank Dr. Frye, Keith and his team at the State Health Department, the wonderful men and women at the Oklahoma National Guard, our local public health workers, and healthcare professionals all across our state for the great job they've done. We have the sixth highest percentage right now of all the states of people with at least one dose of vaccine in the country, top 10. And I can't thank enough of those folks at our health department that have got that done, so great job. We've administered more than 600,000 doses across the state at this point. Again, I'm so proud of our team and how they're getting those vaccines out across all 77 counties to make it available to Oklahomans. Let me turn it over to Dr. Frye now to give you an update. Dr. Frye.
Thank you, Governor Stitt. I continue to be extremely proud of the significant progress that Oklahoma has made in vaccinating our most risk population. Getting the vaccine to Oklahomans continues to be a crucial step in our continued efforts to this pandemic. We encourage all eligible Oklahomans to get the vaccine when it becomes available to them. These vaccines are safe and highly effective. The FDA has rigorous scientific and regulatory processes in place that ensure the safety, effectiveness, and quality of the COVID-19 vaccines. The Moderna and Pfizer vaccine have been shown to be 94.5% and 95% effective, respectively. This means they're very effective to keep you from getting seriously ill or dying from COVID-19. It's also very important that you get both doses of the vaccine. The vaccine will not be as effective if you do not get the second dose. For those individuals in these next priority groups, we encourage you to sign up through our online portal in the next 10 days. If you haven't done so already, just to ensure that you are notified when you become eligible for the vaccine. The portal will also remind you about your first and second dose appointments. The portal is just one of the solutions to this. You can also reach out to your local pandemic providers to schedule a vaccine or your local health department. As a result of our progress and increased vaccine supply, we're happy to announce that starting February 22nd, we plan to start vaccinating the next high-risk priority groups outlined in Phase 2. Oklahomans under 65 with comorbidities and teachers and staff in pre-K through 12 schools and educational settings. We've made significant progress in vaccinating Oklahomans over 65. We feel it is the right time to begin vaccinating more of our at-risk population. Some of the comorbidities or medical conditions outlined in the plan are the following, but not limited to these. But hypertension, obesity, cardiovascular disease, diabetes, chronic lung, liver, and renal disease are all people who are at high risk of mortality or severe morbidity resulting from COVID-19 infection. Vaccinating our most at-risk neighbors is key to preventing serious illness and deaths related to COVID-19. It's also important for us to prioritize our hard-working teachers and staff. Our goal is to ensure that any teacher who wants to receive COVID-19 vaccine has the opportunity to do so by spring break. Deputy Commissioner Keith Reed will provide further details on that process in just a moment. As we work through this process, please remember that it takes all the tools that we have to stop this pandemic and safely continue our lives until we can establish our new normal. While we're making great progress, we're still working with limited supply of vaccine. It is vital that Oklahomans continue to take precautions to slow the spread of COVID-19 because of this. So everyone needs to continue to wear a mask, wash their hands, and watch their distance. These actions, in conjunction with the vaccine, can make a significant difference in keeping our families and communities safe and healthy. I'm now going to turn it over to Deputy Commissioner Keith Reed.
Thank you, Dr. Frye. I want to thank our planning team and our state and local partners for their tireless efforts, as well as their flexibility throughout this vaccine rollout. Because of them, we've been able to vaccinate hundreds of thousands of Oklahomans who are now protected from COVID-19. Of course, there's a long way to go as we continue our work to protect Oklahomans. As a reminder, we have chosen an overlapping approach to Oklahoma's COVID vaccination plan, meaning we begin the next priority group prior to finishing the current one. This ensures we maintain proper momentum while accounting for the difficulty in predicting uptake rates and possible vaccine hesitancy. Though we're moving forward with providing the vaccine to pre-K through 12 teachers and staff, as well as Oklahomans with comorbidities, the vaccine is still available to those included in earlier phases, such as healthcare workers, people 65 plus, and our long-term care staff and residents. I do also want to emphasize that this portion of Phase 2 will likely take some time to complete. So we ask that Oklahomans continue to be patient with us as we expand to this larger population. We estimate there are 89,000 Oklahomans who qualify as teachers and staff and just over 1 million Oklahomans with comorbidities who will qualify during this period. As we do receive increased vaccine supply from the federal government, we'll be able to open up new access points across the state. We're also participating in the new federal retail pharmacy program, which will provide additional doses to over 70 pharmacies across the state. Even so, this portion of phase 2 includes a much larger group of Oklahomans, and even if you are eligible, it may be some time before you're able to get your appointment. Vaccine supply is still limited, but we are working hard to vaccinate as many Oklahomans as we can, as quickly as we can. We ask for your patience and encourage you to regularly check the vaccine scheduler portal and your local news and local outlets for other scheduling opportunities over the next several weeks. So to vaccinate our teachers and staff groups efficiently, we will be taking a highly localized approach that allows us to work directly with school districts to determine their needs. Our regional directors across the state are initiating conversations with school districts in their areas to determine operational details, such as number of doses needed at each school. Much groundwork in planning for vaccine uptake in schools has already taken place through the extensive work of our education partners. Based on this information, the team will determine optimal locations to set up pods in counties across the state. Starting the week of February 22nd, we will be focusing select resources on these predetermined locations to most efficiently coordinate a 2 to 3 week effort to vaccinate as many teachers as possible. As we plan and coordinate to implement this concentrated vaccination effort, we need the help of our school districts. For our school administrators across the state, we ask that you work with your local county regional director or COVID vaccine program manager in getting us the following information: number of teachers and staff who wish to receive the vaccine, dates and times you can make teachers and staff available for vaccination, and any other information that might contribute to an organized and efficient vaccination effort. Regarding Oklahomans with comorbidities, it is our intent to focus vaccine resources specific to this group as well. We recognize that many in this category may best be served through traditional or specialty healthcare venues. As such, we intend to expand vaccine availability to pandemic providers that service Oklahomans with many of these conditions. Many of our current pandemic providers already have a strong presence in these environments. Hospital systems, federally qualified healthcare centers, pharmacies, cancer centers, and dialysis centers are excellent examples of access points that serve Oklahomans with comorbidities. Allow me a moment to also address weather impact on vaccination clinics. For Oklahomans that have an appointment that is impacted by weather, you will get your vaccination. It will be rescheduled locally. With weather in mind, please know that we are allowing limited flexibility in our clinics to ensure no waste of vaccine or resources committed to operate these clinics. Specifically, this means that we are asking clinics to stick with the current authorized priority groups, but if they are unable to exhaust resources, deviations in priority groups can happen but should be limited to the 2 groups scheduled to begin on the 22nd. In spite of all the challenges inherent in this operation and those fresh challenges given to us by Mother Nature, we are optimistic about our progress and will continue to push until every Oklahoman who wants a vaccine has access to it. With that, I'll turn it over to Secretary of Education Ryan Walters to speak on what this means for Oklahoma teachers and students.
First, I want to thank Governor Stitt, who has been relentless in his pursuit to open schools safely and his commitment to putting students first and keeping teachers safe. Your early decision to move our teachers into phase 2 of the vaccine plan is what makes today possible. Teachers and other school employees in our state are now set to get a vaccine long before the end of the school year. Governor, on behalf of tens of thousands of educators across Oklahoma, I thank you for that. I've spoken to countless parents across Oklahoma who are worried about their kids, worried about their mental health, worried about the setback of 1 year out of school and what that could mean for their future. And I'm a parent. I also share those same concerns. Distance learning works for some, but not all. Too many parents have been robbed of their unique ability to make the best decision for their kids. Today, we're moving one step closer to giving parents back that decision. We're also one step closer to getting kids back in classrooms. I'm also a teacher, and I know and share their frustrations of being out of the classroom. We became teachers to be with those kids, to be with our students, to see them learn and grow and develop those relationships. Now, and for clarity, 99% of our school districts have been in person in some capacity. And I know how far above and beyond teachers across the state have gone for their students. I've talked to kindergarten teachers who are still finding ways to do their play-based learning with their students in a safe way. I've talked to high school science teachers that are still able to do those experiments with their students, making sure that students stay safe and they stay safe as well. And I've heard from teachers at all grade levels that have just gone above and beyond any kind of expectation to ensure that they're maintaining personal relationships with kids in person and virtually as they've navigated this pandemic in their school. These teachers are the ones that are making this education possible for our students during this time. It's also not just teachers who've been affected inside the schools. Everyone at a school plays an important part in a child's life. Bus drivers, administrators, the cafeteria staff, all of these individuals are doing all they can to make this difference for our young people. Now, we as educators have the opportunity, that choice, to take this added precaution and to get the vaccine so that we can get back to doing what we love. I also want to thank our local public health workers who will be coordinating with school districts, and to thank all of the school boards and administrators who have been working hard to put their students first. After that, I'm going to turn it back over to Governor Kevin Stitt.
Thank you so much, Secretary Walters, and thank you, Keith, for your leadership, Dr. Frye. I just want to recap a couple of things that before we open it up to questions. Teachers and school workers of all ages, as well as Oklahomans with comorbidities, will be eligible for the vaccine starting February 22nd. That's a week from this coming Monday. If you're a school administrator, please help us by being prepared. Please check with your teachers and staff to find out how many of them want a vaccine. And think about dates and times that you can make them available for our team at the health department. Getting that information to your county health department's regional director or COVID vaccine program managers will make this process as smooth as possible. So with that, I'll open up to questions for any of our team here.
Yeah. Okay. The first being, what changed, in the past couple of weeks? I know the health department was kind of moving toward this decision. What changed to allow this to happen? Was it more supply? Kind of what changed?
Yeah, let me let Keith Reed answer that on the supply side.
Thank you for the question. We have seen moderate increase in our supply, not a great deal of increase, but we've also been monitoring our progress with our 65 plus population. When we're looking at the numbers, we're around 45% of that population that is represented in our database. But when we check with our partners that are receiving federal allocation, including tribal partners, and then through the Veterans Administration, that number goes up to around 56%. So as you can see, we're really starting to get over the hump with the 65 plus group. And we've always been very clear that we don't want to wait to exhaust the interest for a particular group before we bring on the next one. We also felt like as we move into comorbidities, that is another opportunity to help get more 65 plus as well. And with the addition of the retail pharmacy program, it's actually 76 pharmacies in the state. We've added another 18 on top of that. We feel like we're getting better access, more access points out there, and we just feel like it's time to go ahead and make this move.
The other one I had for you, if that's okay, is how will people verify that they're in one of these groups? If they're a teacher or staff, or if they have a comorbidity, will they be required to verify that in some way?
So with teachers and staff, the best way for us to verify that is through these local concentrated efforts with the schools. So our plan is to really work with the school systems and coordinate clinics that are focused on them. So that's the best way to take care of teachers. For those with comorbidities, what we really want to see is their healthcare providers really help make those decisions on vaccinating them. We will vaccinate those outside of just the healthcare system, those that may come to our larger pods through the scheduling portal. We have asked that they check off an attestation within that portal that verifies that they have those conditions. At that point, we're going to take them at their word that they meet the criteria, because when you get into too stringent of a screening process, you're going to really eliminate efficiencies in our overall program. So it's a combination.
You guys have started vaccinating on a limited basis people with comorbidities. We're hearing like on social media that people are cheating. You know, essentially they're showing up at these pods and they don't have comorbidities, and they're going home and telling everyone that you're giving vaccines to people in phase 3 and 4. I mean, are you worried that people are being dishonest on the portal because they're desperate to get a vaccine?
It is something that that is disappointing to hear that happens. And I would ask all Oklahomans, I think we'd all ask all Oklahomans to be honest about this and understand that this plan is put forth to take care of our most vulnerable first. You know, be a neighbor, be a good Oklahoman. Make sure that you are answering honestly and you're reserving these vaccine appointments for those that need it most. It's inherent in the system when we're trying to vaccinate the entire state of Oklahoma that we're going to have some issues like that, and we don't want to create a system that becomes so restrictive just to try to eliminate a few of those that are abusing the system. We don't want a system that is so restrictive that it cuts down on our efficiency moving forward.
Obviously, this might be down the road a bit, but I mean, at what point do you expect to be vaccinating people in prison, jails, juvenile facilities? They were moved down the list essentially to move some of these other folks up. Is that right?
So that's what we call the congregate care settings or congregate housing settings, which is behind these groups. As I mentioned in my comments, we're potentially looking about 89,000 Oklahomans that would fit into the teacher category, and a little over 1 million Oklahomans that would fit into those with comorbidities. Now, if you look at our original plan, we had that listed as 1.3 million. We went ahead and made adjustments based off of those that are 65 plus that we've been given opportunities to vaccinate at this point. So we're looking at a lot of people in these two categories that we need to vaccinate. It would be a little premature for me to try to estimate at what point we'll be able to get to the next one. Again, it depends on vaccine supply, which also depends on the potential for Johnson & Johnson to come on board as a new resource. All those factors got to come into play before we're really able to tell when we're going to be able to move to the next group.
We have a question from Zoom real quick. This is from Rick Marinan, Fox 23. Can the incoming severe weather impact our state's vaccine burn rate so much that the federal government will reduce the amount of vaccine they give us?
I do not anticipate that happening. So let me just say the weather is very frustrating for us because it definitely inhibits our progress on the vaccination efforts, but we want to prioritize safety first, especially right now when we're working with our 65 plus population. That's one reason I made the comment that we will have some limited flexibility with clinics even next week, in which case, if they're not able to use all their supply or not able to use the resources they have set up in existing clinics because of cancellations, some people are unable to get there, that we're going to allow them to work into some of these groups as well to make sure and use up those resources. I do not, at this point, the federal government is not withholding vaccine based off of burn rate. So that would tell me that we should not have a problem with reduced supply because of that.
I have a question for Secretary Walters and the governor as well, if you want to answer. Regarding the discussion of districts, getting back open, and it seems like sometimes these press conferences lead to, a response from Twitter or Facebook or something like that. And I think all of the journalists here know that when you talk maybe behind screens and things like that, you get worse responses than if you have sit-down conversations. Have either of you gentlemen have sit-down conversations with Tulsa Public School board members, the superintendent there, the OEA? I mean, has there been a gathering to say, hey, let's clear the air and move this forward and find some solutions?
So, we've tried to be very clear in kind of our language that we want students back in school, that's ultimately what we want. And again, Most school districts, the overwhelming majority, have found ways to do this. We've been in constant communications with different school leaders, associations, and so those will continue moving forward, and we're always open to those conversations and communicating with those folks and to do what we can to help students get back to school. But we think that the governor's investment in PPE for school districts and the changes in the quarantine policy have done a lot to allow that, and that came from feedback from school leaders, from associations involved in education, directly from parents and teachers. So those have been part of the ongoing discussion, that when we hear from them and we hear about these barriers, we hear these concerns, that's where a lot of those decisions have been made based on that feedback.
So just to be clear, the last time you had direct conversations either on phone or Zoom with Tulsa Public School board members would be?
Well, I don't want to get into the specifics of when the last time we've talked to them, but we do have communications with the associations, with the school leaders across the state.
Okay. I do have one question for the commissioners. We just got an email from your department that announcing another 48 deaths, and I think yesterday it was 38, and I think the day before that was 50. We're approaching 4,000 casualties as a result of COVID infections, or tied to. You talk a lot about the data. What is the data? Is there any new data or any new trends or anything you're seeing in the people who maybe are most likely to pass from this that you're learning from? Any revelations there?
Short answer is no real revelations. I mean, it's people that are at high risk, but you have occasionally some younger person who you wouldn't think would be high risk that also passes away from COVID. You know, we looked at, for instance, the numbers today. I think most of those were back in November. So there is a delay in the reporting of those sometimes. So it's a statistic that lags. And so we're still, and it's not just in Oklahoma, it's nationwide. They've been on multiple calls with the Government Association, et cetera, talking about how everyone is seeing the trends coming down, but their death rates are still high right now.
Governor, can I ask you a question? You've one of your big priorities obviously has been opening schools, but your other big priority is keeping businesses open. Why are critical infrastructure employees so far down the list? The people who work in our grocery stores, our restaurants, drive our trucks.
You know, it's just a matter of the vaccines coming in the state, and so as we've talked about, Oklahomans. We are number 6th right now in the country in getting vaccines out per capita. I've been on calls. I've also talked to our federal delegation to make sure we can get as many as we can in the state. You know, the Pfizer CEO, when we were on calls with that group, really believe that supply will outpace demand here in the next couple months. So that's a great news all across the country. But right now you have to prioritize, and so the team can talk about what group we put together to lay these priorities out. But yes, everybody's important. We're trying to get them out as quickly as possible. And Keith was talking about there's 1 million people in Oklahoma with comorbidities. We think that's an important group to, but obviously the workers in restaurants and restaurants that have comorbidities will be in this group, the ones that are in also the grocery stores, et cetera. So that's kind of how we're prioritizing at this point. But as soon as we can get more vaccines, we're going to keep opening that funnel up. And I've told the team that within 7 days of those vaccines hitting Oklahoma, they've got to be in arms and through the population. And so I'm just really proud of how the team's done at this point.
I have one, maybe this is for Deputy Commissioner, but does teachers and staff include K-12, universities, daycares, or what's the specific group on that?
So if you look at our plan, we actually have 2 categories. This particular category is pre-K through 12. It includes teachers and support staff that are involved in keeping the schools open and operating. So bus drivers, cafeteria workers, janitorial staff, they're all an important part of that. When you look at the behind that, you get into another group was expanded education. That's when we get into those other groups you're referring to right there. So this group is pre-K through 12.
Not post-secondary.
Not post-secondary. No.
When will people?
From Zoom for you, Deputy Commissioner. This is from Cassie McClung. If a healthcare professional deems a patient has a comorbidity outside of the state's list, are they still eligible for that next phase off of the healthcare professional's recommendation, for example, like a disability?
So I think you're asking, if I understand the question right, you're asking, are there options outside of the specific conditions that are listed?
Yeah, so if the state, if it's a comorbidity that's not on the state's list, but a physician still recommends them for the vaccine and calls them at risk, are they still eligible?
Yeah, we're gonna leave that decision with the provider. Absolutely. They know their patients best. That's one reason we want to get this within the healthcare system to make a lot of those decisions, because that list that we have is based off CDC recommendations that are known to really negatively impact somebody that catches COVID and lead to increased hospitalization, increased risk of death. But we also recognize the physician's expertise on the condition of their patients that may identify some outside of that group. So we're not going to police that. We're going to allow them to make that decision.
When should people expect to get a registration email for the portal? Will it be February 22nd, or will it be as early as next week?
So the way it works is when you go in and register, you will be identified within that group. On February 22nd, we will, on the backside, we'll turn on that group, and that'll initiate those emails. You had a question?
I do. What do you say to people who are going to miss 21 day or 28 day?
For the booster shots because of weather? Okay, glad you asked that. Want to remind everybody that CDC has come out and said that you're fine for waiting up to 6 weeks, really, for that booster shot. So for those that are concerned that their booster is going to be delayed, we should still be able to take care of them well within that window of the 6 weeks. And that will be, as we've done all along, we'll focus our appointments on addressing boosters first, and that way people will make sure and get their full protection. But know that the local clinics that are being canceled now because of weather, they're already working on plans to reschedule those and notify those individuals so that they can get their vaccines as soon as possible. Unfortunately, if you look at the weather for next week, it's not going to be easy. It's just another challenge with this vaccine program, right? I mean, we talk about all the logistical challenges, and now Mother Nature wants to make it a little bit more of a challenge for us.
Is it 6 weeks from the date of your initial vaccine, or is it 6 weeks from when you're due to get your second vaccine?
From your initial vaccine, yeah. And then let me make sure, and I don't want anybody to panic if they go, 6 weeks in 1 day or something like that. They've also said if it goes beyond that, you go ahead and get your second dose and you move on. You don't worry about having to start over on it. Okay.
Thanks, everybody.